pretty early in Australia, so thank you very much for getting up before sunrise for us. And we very much look forward to hearing about the effects of COVID and other aspects as well.
Thank you so much, Siobhan. And yes, it was a pre-dawn rise this morning, coming to you from Sydney, Australia, where it's 20 degrees Celsius. And I'm just going to share my screen. So I would also like to acknowledge the traditional owners on the land from which I speak, and that is the Gadigal people of the Eora Nation. And I want to pay my respects to their elders past, present and emerging. So thank you, Lisa, for that amazing talk. And we do have, I guess, different perspectives and experiences, but I think this is part of the joy of veterinary ethics, coming together and exploring those in a bit of detail. And it's also great to hear about people's career trajectories, because I think a lot of us who are involved in the field of ethics and looking at moral stress and moral distress have our own experiences that have kind of driven us to this interest. I started my veterinary career not really as a veterinarian, but I trained in philosophy, and I was intending to be a philosopher, and I did my undergraduate and honours degree in philosophy. And then I went to the Careers Centre and they said, you can be a bank teller now. And that wasn't really why I studied philosophy. And that prompted a bit of philosophical exploration and navel gazing. And I decided actually really what I wanted to do was apply philosophy to something, and what better than apply it to being a veterinarian. When I then became a veterinarian, a lot of that went out of the window because I was really focused on getting things right and getting the diagnosis and looking after the patients. But I really came back very quickly to an interest in veterinary ethics and philosophy. So that's my background. And I'm really going to talk briefly about my work looking at ethically challenging situations encountered during the pandemic. This forms part of my PhD, which when I enrolled had absolutely nothing whatsoever to do with pandemic. So I'm just going to encourage my slides to advance because they're a little bit slow this morning. So for this talk, I'm going to be focusing on an international mixed method survey that we undertook of veterinary team members during the early months of the pandemic. And when I say we, I should also acknowledge that Professor Siobhan Mullen is one of my supervisors as well. I'm not going to be discussing the methodology or even the majority of the findings of these studies. They are available as open access studies, and the details are in the reference list. But rather, I want to discuss the findings in the context of this discussion of moral stress and moral distress and veterinary ethics in general. So there won't be a lot of stats involved in this. But we did have 540 respondents from around the world. And one of the things that I would like to highlight is our study included veterinary nurses, technicians, practice managers, receptionists, and so on. So I refer to veterinary team members. So I want to talk a little bit about my understanding of moral stress. And I contend that the terms moral stress and moral distress have often been used interchangeably in the veterinary literature. And so the way I conceive it, and I understand people have different views, moral stress is the stress that comes about when we're dealing with ethically challenging situations. So we might make a great decision that we're really happy with at the end of the day, but it still involves a stressful process sometimes, not every time. But moral distress is a bit different. So as defined by Monique Crane and colleagues, and Monique is an Australian psychologist, moral distress occurs when one engages in or fails to prevent decisions or behaviours that transgress or come to transgress one's personally held moral beliefs. And moral injury, as I understand it, is a kind of a chronic form of moral distress. And for some people, it's career ending and something they may not come back from. So in healthcare, there's been a discussion, particularly recently, the one initiated by Doctors Wendy Dean and Simon Talbot, around this idea that what's previously been considered or described as a burnout crisis in physicians is actually more a moral injury crisis. And that's sort of set in a background at a time where clinician autonomy has been eroded and healthcare systems prioritise key performance indicators over patient care. So sadly, late last year, veterinary ethicist Bernard Rowland passed away, and he was the first person that I'm aware of to use the term moral stress in the veterinary ethics literature around 1986 in this paper. And in light of the previous slide, I believe that he was actually describing a phenomenon that's more consistent with moral distress and even moral injury. So when we talk about moral stress today, we think largely about the mental well-being of veterinary team members and how it impacts them, and in the context of what's been called this sort of crisis of well-being in the veterinary profession. But my interpretation of Professor Rowland's early discussions of moral stress is that his focus wasn't really primarily about addressing this crisis of well-being for the veterinary team directly. Rather, I think the moral stress of these team members for him was an indicator of a severe and the severity of a systemic problem that needed urgent addressing, i.e., the killing of large numbers of healthy animals in shelters, in laboratories, and even private veterinary practice. So enormous was this scope of killing that not only, should we be worried about the animal welfare indications, but those doing it were depressed and even suicidal. And so the thrust of his argument was this problem is so bad that it's affecting human health and well-being. So Rowland described that this situation where people who loved animals and who chose to devote their careers to them found themselves spending their time killing healthy animals, often for very spurious reasons, so that they're working against their own values, and indeed it was affecting their mental well-being. So I think Professor Rowland saw the mental ill health of these animal carers primarily as an inevitable effect of poor animal welfare practices and urgently needed to be addressed. And the solution that he proposed in this paper was that for these people, so vets and shelter staff and so on, to clarify their own ethic, to explore their own ethic with regard to animal use, and set about, quote, doing everything in their power individually and collectively to actualize that ethic. So the way out of this moral distress was changing the status quo, changing the situation where all these animals would be killed needlessly. And I should clarify that I don't believe, and I don't think Professor Rowland believed, that all mental health problems among veterinary team members can be addressed by proactively addressing these factors leading to moral stress or distress. Sometimes people need psychological support and treatment. And I think his qualifier in their power is very important, because not all things are in our power to address, especially as Lisa mentioned, this powerlessness, particularly of nurses and perhaps veterinary technicians as well. So this understanding, and I appreciate that Professor Rowland isn't here to jump in and clarify, but this understanding has informed my views of moral stress and moral distress as indicators of systemic issues that might need to be addressed, and often beyond the level of the individual practitioner. So I think that documenting the types of ethical challenges faced by veterinary team members during a pandemic is not simply an exercise in just recording or an interesting anthropological exploration, but it's an attempt to work out what do we need to do to prepare our veterinary team members and other stakeholders for these now known and predictable challenges in the future, and the future pandemics that we're all told are going to happen. I think it's important to consider context as well when we consider ethically challenging situations, because contextual factors are highly relevant. So these challenges occurred in the context of, the challenges that occurred for veterinary teams during the pandemic I'm talking about, and continue to do so, have occurred in the context of scarcity of resources. Like at the moment in Australia, we've seen shortages of food because of sickness absenteeism affecting our supply chain. Shortages of personal protective equipment. So this photo features a picture of me wearing a cloth mask, which we know are not that helpful, that was made by my mum because we couldn't get in any PPE at the start of the pandemic. Staff shortages due to sickness absenteeism or caring duties or homeschooling, shortages of vaccinations and PCR tests and rapid antigen tests as well. The pandemic has caused massive social disruption, impacting transport and travel and healthcare in general, and education, and the movement of people outside of their homes, and our ability to contact and connect with others, including many of our close family members. It's been a time of fluctuating but widespread and often profound anxiety about a disease with the potential to cause high morbidity and high mortality. The risk of this overwhelming surge, collapsing our healthcare systems, changing and often very confusing healthcare messages and mixed messages in the media and social media, And so some of you have heard the term infodemic, which we're suffering a sort of a concurrent infodemic while we suffer the pandemic, and that's also caused societal disruption as well. And in general, I think it's fair to say, and I'm happy for others to disagree with me, that veterinary service providers, like other professions, were underprepared. There's really little redundancy in our workplaces, and for all our knowledge about preventing zoonoses, many hospital plans and hospital emergency plans, where they did happen to exist, and many hospitals didn't have emergency plans, didn't factor in a scenario where humans could actually spread a disease to humans. We were really more focused on the risk of zoonotic diseases, at least in the protocols that I've examined. So stakeholders are those who are impacted by an ethical decision, and traditionally in the veterinary ethics literature, we've heard about the triad. Gerard Tannenbaum talks about this triad between the patient and the vet and the client as the main stakeholders. And I would actually argue that even pre-pandemic, this was a little outdated, as it doesn't reflect the reality of most veterinary teams, which usually consist of more than a vet. So often vets aren't sole charge, they aren't self-employed, they work as part of teams. And the triad doesn't really reflect that. But regardless, that shifted dramatically at the start of the pandemic due to the highly infectious nature of SARS-CoV-2, when overnight veterinary team members needed to consider how their decisions impacted not just the patient and the client and themselves, but also our families and our household members and those we come into contact with, and also the families and household members and the contacts of our clients as well. And there are other stakeholders I haven't listed here, like the healthcare services and healthcare providers, whom, for example, we were told we needed to preserve PPE, we needed to give ventilators to human healthcare service providers, nor does it include stakeholders like veterinary students whose education and training were incredibly, monumentally disrupted at the beginning of the pandemic. I also want to say that I've come to realize certainly that ethical frameworks aren't a panacea for moral distress. So the traditional model of veterinary ethics is reliant on teaching various ethical frameworks like utilitarianism and deontology, virtue ethics, principlism, and other frameworks like Ben Mepham's Ethical Matrix and David Fraser's Practical Ethic for Animals. And I think these are especially helpful in making sure when we look at an ethical challenge, we take into account the views of lots of stakeholders, and they can be really useful in helping us justify our ethical decisions, and also helpful for us understanding how others justify their ethical decisions. But the way we teach them and the way they're constructed, and kind of the history of Western philosophy is a little bit biased towards this, an assumption of an autonomous decision maker or makers. And a lot of these frameworks assume that we've got the information that we need to plug into them, that we have access to the key information. So for example, we know the main costs and benefits of our decision, or we know how to minimize harms and maximize well-being in relation to a particular decision. And they give us no real guidance about how to manage relationships. So for example, when it comes to the crunch, who do we save in a fire? Do we save the stranger next to us, who's very easy to save, or do we go up a couple of flights of stairs and save our own child? The other thing about ethical frameworks is they're really hard to apply. They take time in terms of application. You might need to sit down. The ethical matrix takes me a few hours to comprehensively fill out. And of course, time is something that's incredibly limited normally for veterinary team members, but particularly in a pandemic. And even when everyone's on board with the same ethical framework, there can be a lack of consensus about which factors are taken into account and how we weigh them up in relation to each other. So for these reasons, I don't think they are a panacea to moral distress, but they are important and useful tools. They're just not the whole toolkit. So I want to go through a couple of very brief, very general examples here. Previous surveys have shown us, as Lisa mentioned as well, that client financial limitations are a common ethical challenge for veterinary team members, although there's some nuance about whether they're experienced as an ethical challenge by all team members. And the work of Lisa Moses and indeed Barry Kipperman highlights some of those kind of nuances around that. Certainly client financial limitations we found were the most common ethically challenging situation in the early months of the pandemic. So when I did my research, it was May to July. So when things had really, really taken off for the first wave. And I guess it was like economic limitations on steroids. So respondents talked about clients who had financial limitations because they had been made redundant or their working hours had been dramatically slashed. And the other thing that veterinary clinics at the time were juggling was their own lack of income, because some of them had to close temporarily. Some were not able to provide services because of staff isolating or due to sickness, absenteeism, and so on. Concerningly, there was also more economic euthanasia of animals with what respondents felt were ultimately treatable conditions as well. So in the free text comments, people talked about clients being more quick to jump to euthanasia as a treatment option for animals, say with severe dental disease or a broken leg, conditions that veterinary teams feel were very treatable and they had the skills to treat. There were also I guess one thing that we didn't look at, one big gap in our survey, was we didn't look at the client experience. And I suppose it's almost certain that clients who can't pay for treatment due to economic limitations also experience significant moral distress as well. So I guess during the pandemic, those without access to any veterinary care and those without access to the veterinary care that their animals needed expanded. So in this picture here, I've got a copy of the Access to Veterinary Care Coalition report, which was released prior to the pandemic. But I guess this base of clients whose animals really aren't getting veterinary treatment grew. Two of the most stressful and common ethical challenges early in the pandemic, which I've already alluded to, were conflict between our personal well-being and the well-being of our family or close contacts and our professional role. So many respondents found themselves weighing up the costs in terms of health as well as financial risks and benefits of continuing to attend work independently of the public health advice. Remember at the time, and there's been a lot that's happened since early 2020, we really didn't know very much about this agent. We didn't really understand how it was transmitted, whether it affected animals, whether we could be transmitted from companion animals to veterinary team members, for example, how infectious it was, what treatments worked. We didn't have vaccines and we didn't have an evidence base for treatments. Those who continued to work sought to minimize risks. So for example, through eliminating or reducing client contact and using PPE, which was again a very scarce resource at the time. And one challenge is that a utilitarian approach, which people often use, is very difficult when we're comparing costs and benefits if we don't know what those costs and benefits are. So and the other thing is, how do we weigh them? How do you weigh your own health and safety versus the health and safety of your clients and patients? So a strict utilitarian might favor an outcome that is going to benefit the greatest number of stakeholders. But then that doesn't take our relationships to others into account. So, so there were a lot of unknowns there that complicated this process. I guess, what does this tell us? I think we need better training to prepare us to minimize the risk of human-to-human transmission of disease in veterinary settings, but we also need resources being able to do so, like having enough PPE, which is something that I guess our professional associations can help us secure in the future. A sort of an extension of this dilemma, but one that was brought up independently in the free text comments by almost a fifth of our respondents, was the idea of low and no contact euthanasia. So low contact euthanasia involving, say, the client wearing a lot of PPE and socially distancing from the veterinary team, having euthanasias outdoors and so on. Versus no contact euthanasia, i.e. that is where the animal's taken from the client and euthanized away from the client. So to minimize or eliminate contact of the veterinary team with the client. So it's sort of encapsulated in this dilemma contributed by one of our respondents, an Australian veterinarian, who said, in the case of very sick animals, emergencies or euthanasias, owners are distressed about not being able to be with their animal. Do you cave and let them be there, knowing that if you get COVID-19, the entire clinic team and possibly other clients could get infected? Or stick to the policy, knowing you are causing emotional distress to the owner and the animal? So in some cases, our respondents did describe just following the rules and performing no contact euthanasia, but being quite distressed about it. And some felt like they really had to do that, and that was the right thing to do to protect their team. Whereas others talked about breaching protocols or breaking the rules or finding workarounds because they felt they had to do that. So what does all this moral distress tell us? Again, I think we really need to develop a specific toolkit and specific training about low contact euthanasia so that this can be performed wherever possible. So I've got a few concluding thoughts here and happy to expand these in the panel discussion. I think the ethical challenges that veterinary teams encountered and continue to encounter during the pandemic are different from those that occurred before, really due to contextual factors. And no doubt we're going to see others still in the future of this pandemic, particularly as we see rolling resource shortages. A pandemic impacting to date predominantly humans broadened the stakeholders that we explicitly have considered as veterinary team members. So I would say the veterinary client triad doesn't really hold up as the space within which all veterinary ethical challenges occur. I think understanding the types of ethically challenging situations that we and other groups like healthcare workers do encounter during pandemics can help us predict and prioritize efforts and plan, for example, in rapidly developing and updating guidelines, but also ensuring this information is presented in an accessible way. And I think professional organizations can play a really important role in helping us plan and develop those guidelines and rolling them out. I don't know about the rest of you, but my capacity to read and implement a 100-page biosecurity document in the midst of a pandemic and staff shortages is extremely limited to negligible. So that's at least what I found. And I think a lot of our respondents found the same. And the other thing that we noted from the free text comments was even the implementation of biosecurity protocols, the interpretation of them was a source of conflict among employees and employers. Teaching ethical reasoning alone is not going to solve moral distress among veterinary team members. We need to do a little bit more, and perhaps Vanessa is going to talk a bit more about that in terms of facilitating discussion around ethical challenges. Finally, I think we need to consider the impact of veterinary challenges on veterinary teams and clients, not just veterinarians. We need to include them in discussions of ethical challenges and understand the unique challenges that they experience as well, and ensure that training is available for all veterinary team members. So there's a couple of references there, and I'm happy to share those with anyone later on. Thank you.
Thank you so much, Anne. Yeah, fantastic. I'm sure many of those experiences will be mirrored around the world, you know, by folks listening to this, and they'll have kind of a high resonance of working through that pandemic. There's some lovely questions that have come in, and please feel free to continue to put the questions in the Q&A, and we will respond to those after Vanessa's talk. So as Anne